B2, its chemical name is riboflavin or riboflavin, which contain this ring isoalloxazine. Isoalloxazine. Vitamin B1 contain thiazolium ring. B2 contain isoalloxazine ring. Vitamin E contains, vitamin E ki ring thake? Chromain. Now, there are different types of riboflavin depending on their sources. If they are isolated from milk, they are called lactoflavin. If they are isolated from liver, they are called hepatoflavin. If they are isolated from egg, they are called ovoflavin. When they are exposed to UV light, they show fluorescence. Exploiting this property, riboflavin is used for visualization of nucleic acid. Nucleic acids can be visualized by certain intercalating substances like ethidium bromide, acridine orange, etc. These compounds, they make space within the base pairs and they emit fluorescence upon irradiation with UV light. The same thing can be achieved replacing acridine orange or ethidium bromide, which are otherwise harmful compounds, carcinogenic compounds, by riboflavin. So, one of the great use of riboflavin is in the laboratory for visualization of nucleic acid. This is a structure of isoalloxazine ring. Mark this 2 nitrogen. This is a alcohol, 5-member alcohol called ribitol. Ribose, when reduced form, ribitol. So, ribitol is attached here. Fine. When they are phosphorylated by enzyme flavokinase, they form FMN, flavin mononucleotide. Why mononucleotide? This is one nitrogen base. This is one nitrogen base, right? What is this base? What is the name of this base? So, it is a nucleotide because it contains one nitrogen base, one sugar and one phosphate. So, flavin mononucleotide, FMN. When they are further phosphorylated along with ADP by the enzyme FAD synthase. FAD synthase, remember this enzyme is synthase, not synthetase. Why? Because it transfers adenosyl group, unlike the previous one. Kinase means it transfers phosphate, but synthase, in the next enzyme synthase, here they transfer adenosyl group. One phosphate was already there, one phosphate came from ATP. They transfer AMP to this to form FAD, flavin adenine dinucleotide. Clear? So, riboflavin or riboflavin has got 2 coenzyme forms. One is FMN, another is FAD. Now, you know that there are places for attachment of 2 hydrogen atoms with FAD, right? Where do they add? In these nitrogens. Clear? Now, absorption and transport are very easy, like any fat, any water soluble vitamin. We are not going to that. Just remember, they are absorbed. They are absorbed from upper. Why do you need to remember this? Because similar question came this year. I probably mentioned in last class. Similar question came, and then they gave 4 vitamins. Which vitamin deficiency will occur in case of this jejunectomy? Clear? So, jejunectomy may not create much problem. In this portion, you may get short questions. Okay. enumerate reactions requiring FMN, enumerate reactions requiring FAD. So first with FMN, L-amino acid oxidase. The corresponding L-amino acid oxidase forms corresponding alpha keto acid. This is one oxidative deamination. This is one example of oxidative deamination, L-amino acid oxidase. This requires FMN as coenzyme. Whereas if it was D-amino acid oxidase, the preferred coenzyme would have been FAD. Write down the two. FMN in L-amino acid oxidase, FAD in D-amino acid oxidase. Now tell me, which amino acid oxidase are predominant in our system? L-amino acid oxidase. Which system has got predominant D-amino acid? Which system has got predominantly D-amino acid? Bacterial metabolic. Ekটু elaborate করো. This is partly correct. Fine. This is partly correct. Sit down. Bacteria, they form their outer layer or covering with D-amino acid. But inside they use L-amino acid for their own metabolism. The D-amino acid produced in the bacterial system is used only for synthesis of protection, protective wall. That's all. So that our enzymes, systemic enzymes, cannot digest D-amino acid containing peptide bonds. Clear? But inside, since they are dependent on us, their metabolic system utilize L-amino acid. Clear? Fine. So L-amino acid and D-amino acid are examples of stereospecificity of enzyme. Stereospecificity of enzyme. Give one example of stereospecificity of enzyme. Examples are L-amino acid oxidase and D-amino acid oxidase. L-amino acid oxidase utilizes FMN as coenzyme. D-amino acid oxidase utilizes FAD as coenzyme. So the L and D amino acid, due to this difference, amino acid oxidase are also different. So one answer, 3 questions. Fine. Always try to correlate and relate with other topics which might interfere with this, because nowadays you will not get straightforward MCQs. I tell you, it will be easy to answer the long question, short question, rather than answering the MCQs. FAD requiring enzymes. Examples: pyruvate dehydrogenase complex, alpha keto dehydrogenase complex, succinate dehydrogenase, acyl CoA dehydrogenase. First 3 from carbohydrate metabolism, last one from follow which pathway? এটা কোন pathway থেকে? Glycerol 3-phosphate dehydrogenase, mitochondrial. The same enzyme in cytosol utilizes mitochondrial glycerol 3-phosphate dehydrogenase. It's the same enzyme in cytosol utilizes NAD. Why? What is the function of this enzyme? Anyone? Glycerol 3-phosphate shuttle. transfers electron from outside mitochondria to inside mitochondria. NADH to FADH2. NADH থেকে FADH2 তে ট্রান্সফার করে from outside to inside mitochondria. Sit down. In protein metabolism, do you know this enzyme? Anyone? Glycine cleavage system. This enzyme has got another name called glycine synthase complex. These two are the same enzyme, have two different names. They function as synthesis of glycine or breakdown of glycine, depending on the need of the body. If the body contains more of ammonia, then it functions as a direct removal of ammonia by conjugating ammonia with carbon dioxide to form glycine. And then this glycine can be excreted through urine in the form of hippuric acid. So this is one way to excrete benzoic acid as well as excess of ammonia. If you are not writing these things, you will forget. So glycine cleavage system, or otherwise known as glycine synthase complex, forms glycine from molecular ammonia. This reaction is exploited for excretion of two components, ammonia excess and benzoic acid from the body. The benzoic acid is converted to hippuric acid by conjugation with glycine, and hippuric acid is excreted through urine. So by excreting hippuric acid, we get rid of two things, benzoic acid and ammonia. So what happens in type 1 hyperammonemia? Anyone knows what is that? So CPS1 defect causes type 1 hyperammonemia. In this case, there is accumulation of ammonia in the body. To get rid of this excess ammonia, the patient is fed with benzoic acid. The benzoic acid is found in the form of crystals, just like a sugar, table sugar. The patient is given by dissolving in water, small amount of 1 spoon of like that, and our body automatically must get rid of benzoic acid, and it will conjugate with glycine, and glycine will be deficient in the body. So more and more glycine will be formed by this reaction. Taking up ammonia. So as a result, there will be decrease in blood ammonia level. The patient will pass urine and will pass hippuric acid and ammonia, and both benzoic acid will be excreted. So this is one therapeutic use of benzoic acid. In another reaction, important reaction, is xanthine oxidase. I think in last class Sir has taught purine catabolism. The purine catabolism, the last two steps catalyzed by xanthine oxidase, correct, which require FAD. It converts hypoxanthine to uric acid through xanthine. Mitochondrial glycerol 3-phosphate shuttle আর acyl CoA dehydrogenase কটা হলো? 6টা, আর একটা ডিঅ্যামিনো অ্যাসিড অক্সিডেজ 7টা, তাই তো? 7 reactions from different field and has got immense importance in normal metabolism. Each reaction. So each reaction might be asked as a short question, as an MCQ. Read like this, prepare yourself for examination like this. Don't go on reading like flat. No, relate with other chapters and then see you can remember it better. Now we come to RDA. Sources mainly vegetables, leafy vegetables. So RDA, see I told you, if you don't remember, you just mention 1 to 2 milligram per day for all water soluble vitamin except C and B12. Except C and B12. In C, it is 60 to 70 milligram per day, and in B12, it is microgram per day. So B1, B2, niacin, folic acid, all comes 1 to 2 milligram per day. Deficiency manifestation. These three you remember. B2 deficiency occurs rarely. Usually not. Rarely. What are the causes you see? Whatever you eat, natural product, you will get some B12, B2. So first point is quite unlikely to find in a patient with B2 deficiency in a modern world, in our locality, in our nearby neighborhood. This one, they will first come to surgery department, not to you. They will never come to you. They will come to emergency. That means too much of alcoholism might cause B2 deficiency. Other vitamin deficiency might occur, but B2 deficiency will occur very late in case of alcoholism. Then what is the major cause for B2 deficiency? A diet not having any green leafy vegetable at all. If you are taking only chicken, curry and rice, sandwich without veggies, and if you are suffering from viral infection, then in combination of these two, your poor diet for vitamin and in addition to that viral infection, you have a chance of getting B2 deficiency, very common. Now these patients will be very common to you. They will come from the school going kids to middle-aged people, both, and to diabetic people. So three groups of people will come with B2 deficiency. But like a carpet manner, you can give a multivitamin to supplement all vitamins, which will supply also B2. Preferably, you give only B2 supplementation for these kind of symptoms. What is that? Angular stomatitis, corner of the mouth, these regions will show ulceration. Number one. Number two, glossitis. The glossitis, it is a too aggravated condition when you get purple colored tongue. But before that, this thing will come. What is that? The patient will complain of burning sensation while taking even slightly hot or very less spicy food, but still he will complain of burning sensation. Whatever they eat, it gives burning sensation. It should be cold, and it should be lack of any spice, devoid of any spice. Then only they can swallow it. Otherwise, the moment they touch with their tongue, it gives burning sensation. So these kind of symptoms they complain of, just give them B2 supplementation. Okay? In a couple of weeks, it will recover, mostly. Other things like corneal vascularization will come, but that will occur with some other deficiency also. Serum plasma level not required. This is a sign of angular stomatitis or okay, angular stomatitis, ulceration, fissures or ulcers. It's colorless, water soluble solid and derivative of pyridine. It has two chemical form, nicotinic acid or called niacin, and nicotinamide or called niacinamide. Okay. Nicotinic acid. Now this nicotinic acid is not formed from nicotine, which we get from smoking cigarettes. No, two different compounds. Okay. What is the base product, base compound from which raw material for synthesis of nicotinic acid? Which amino acid? Tryptophan. The structure of nicotinic acid, structure of nicotinamide. Coenzyme forms two forms, NAD and NADP. Full forms needless to repeat. Anyway, if you want nicotinamide adenine dinucleotide, nicotinamide adenine dinucleotide phosphate, NAD and NADP. Anyone who knows the difference in utilization of or use of NAD and NADP in reactions? In which type of reaction we use NAD, in which type of reaction we use NADP? Any redox reaction, NAD. Any redox reaction, NAD. Any reductive biosynthetic pathway, NADP. Reductive pathway, NADP. Redox reaction, NAD. Like glutathione S reductase, correct? NADP. Biosynthetic, reductive biosynthetic pathway like cholesterol biosynthesis, like fatty acid biosynthesis, they require NADPH. The structure of NADP. Just for your eyes only. Need not to write, need not to remember the structure, but remember the components. What are the components? What is this? Nicotinamide. This is one sugar. So this is one nucleotide. Clear? And this is another nucleotide. It is adenosine. This is adenine. This is purine ring. This is pyrimidine ring. Pyridine ring. Pyridine, not pyrimidine. Pyridine. Pyridine means only one nitrogen, 6 membered. Pyridine ring, right? So these two are nucleotides. So that's why dinucleotide. If phosphates are there, it will be added to here. 1, 2. Right? Unlike DNA, means not like DNA. They have ribose sugar. DNA has deoxyribose sugar. Which one? 2' deoxy. Correct? Absorption, just like any other water soluble vitamin from the upper part of the small intestine. 16 to 18 milligram. They never asked all these things. This line you remember. This line. What is that? 60 milligram of tryptophan is required to synthesize 1 milligram of niacin. Never forget this line. So dietary deficiency of niacin may increase the requirement of tryptophan. This pathway also require B2 and B6. So synthesis, biosynthesis of niacin require B2 and B6. Sources, see, all are very tasty food substances. Fish, nuts, etc. Two function. One is coenzyme function, another is preventive function for pellagra. List of enzymes requiring NAD as coenzyme. Any dehydrogenase, correct? any dehydrogenase. You see, all dehydrogenase. Clear? ADP. Recall what I said, reductive biosynergic pathway. So, steroid synthesis, cholesterol synthesis, fatty acid synthesis. Clear? Cholesterol, fatty acid, steroid acid, non-essential amino acid, purine pyrimidine synthesis. এই দুটো রিঅ্যাকশন কোথায় আছে? These two reactions. Last two reactions. In which cycle you find? Which pathway? HMP shunt pathway, the first and third step of HMP shunt pathway, producing NADPH in our body. These are the only two reactions which generates NADPH in our body. Only two reactions which generates NADPH in our body. Rest all reactions they utilize NADPH. Only last two reactions synthesize NADPH. Correct? No way you can replace these enzymes. If these are not there, you are gone. Now, are there any enzymes which can utilize both? There is only one, glutamate dehydrogenase, that too which is found within mitochondria. Only one enzyme, glutamate dehydrogenase, which is found within the mitochondria. In some books, they might have given another enzyme's name in addition to glutamate dehydrogenase. Remember, that enzyme is not found in animals. So, our answer will be only one. GDH, glutamate dehydrogenase, GDH, very important enzyme clinically. A lot of liver function depends on GDH. This is hepatic mitochondrial enzyme called glutamate dehydrogenase, which can utilize both. Means either or. Not and, either or. Deficiency manifestation. Niacin deficiency causes pellagra. Pellagra has symptoms of 3D: diarrhea, dermatitis, and dementia. If untreated, you face the fourth D. Fourth D, which is inevitable, the death. So, diarrhea, dermatitis, and dementia. Very rare, very rare. Unless you have some intestinal surgery for removal of part of intestine, which are responsible for absorption of niacin, or you consume few medicines which require niacin for detoxification, correct? Or you have increased niacin requirement in the body due to some other metabolic dysfunction. Very rare. Or if you are intentionally given diet devoid of niacin, correct? Then only you find niacin deficiency. It is very rare, very rare. Nowadays, you cannot find even a single. B6. B6 is available in three forms: alcohol, aldehyde, and acid form. Alcohol, pyridoxine. Aldehyde, P-doxal and acid, amide, P-doxamine, CH2OH, P-doxamine, তিনটে ফর্ম পাওয়া যায়। অ্যালকোহল, অ্যালডিহাইড আর অ্যামাইড, P-doxamine। আচ্ছা, sources, right? Gut flora, mainly gut flora. Adults 1 to 2 milligram per day. Enzymes which require B6. Aminotransferases, any transaminase reaction, AST, ALT both require P-doxal phosphate, PLP, P-doxal phosphate. Any decarboxylation reaction require PLP. Is there any exception? Yes, there is an exception. Ornithine decarboxylase does not require P-doxal phosphate. It requires rather a pyruvate. Ornithine decarboxylase, it does not require P-doxal phosphate. Rest all decarboxylase enzyme require P-doxal phosphate. Allosynthetase, the first step of heme biosynthesis. Glycogenolysis, tell me in which reaction of glycogenolysis you require P-doxal phosphate or vitamin B6? Glycogenolysis, তুই যেটা বললি সেটা গ্লাইকোজেনেসিসের স্টেপ, লেখা আছে গ্লাইকোজেনোলাইসিস, তুই কি করে বললি ওটা? Alpha 1416 glucan transferase activity. Causes of deficiency, mainly alcoholism, older people due to lack of absorption from the diet, and certain drugs like theophylline in asthma patient. These drugs require B6. Then anti-tuberculosis drug, they require B6 for detoxification. So this kind of medication may lead to B6 deficiency. Deficiency manifestation mainly sideroblastic anemia. What are the drugs that causes deficiency of B6? লিখে রাখো। And remember this slide, very important. You might be given, you will be asked a question depicting any of these drug that a person came to you who is taking this drug for so many years, and the blood report says he is suffering from anemia. What could be the probable cause of deficiency? Which vitamin deficiency may cause this? Right? So if the regime contains any one of these drugs, chloramphenicol, antibiotic, oral contraceptive drugs if you are taking, then cycloserine is taken for anti-cancer, mostly for eczema, kind of dermatitis you take given. Then isoniazid, anti-tuberculosis drug, L-dopa for mental, antipsychotic drugs. Right? So all these things, if you are taking, if anyone is taking, then there is a possibility that he or she might develop a B6 deficiency in long run, which may be reflected in their anemic profile.